Hi everyone, Nathan from Personal Best Physiotherapy in Wodonga. This short video is to teach you how to do hip bridging properly. Hip bridging is a really fundamental exercise that we give in two situations. We often give it if you have outer hip pain, that is hip pain that is on the outside of the hip, sometimes running down the outside of the leg. We also might give it to you if we have looked at you in the clinic and we believe that there's some weakness around the hip area. So this is a beginner exercise for strengthening up the hip muscles. It's most of the time very safe, and this is often where you would start. So if we've given you hip bridging in the clinic, then you can refer to this video for some tips on how to do it properly. Now often we have been using band in the clinic, so some band around the knee, but what I actually find at home, and this is quite simple, is if you just use a belt, that is absolutely fine. And what I found is that if you just put your normal belt above your knees, let me just get this right, and then I've just put it in the same setting as I would around my waist. And what I found is that if you put the belt on basically as though you were putting it around your waist, but just above the knees, that's often the right amount of tension or the right amount of width on the belt. So I've got the belt just above my knees, and then I'm going to come down onto the floor and just talk you through it. Okay. So I'm lying on the floor. I've got my feet fairly close towards my buttock, not as close as they can be, but reasonably close. And then I'm exerting a little bit of outward pressure on the belt, so with both legs pushing outwards. Now depending on how you're going, you might have your hands down on the floor to start with, or you might have your arms across your chest. Let's say you're up to this. So what I'm doing is I'm keeping that outward pressure on the belt, and then pushing down through my heels and lifting my bottom up, and then coming back down again. You don't have to lift your bottom as far as it can go, but you just have to get a reasonable lift off the floor. As I'm doing this, I'm maintaining that outward tension on the belt. That's very important. What that does is help engage as much of the hip muscle as we can. Now sometimes we might give you the offset bridge, which is where we have one foot closer than the other. So one foot sneaks in a little bit, the other sneaks out a little bit. Keep on that outward pressure on the belt. And so what I'm doing now is I'm making my left leg work a little bit harder. So if I wanted to bias this towards my left leg, I would have my left foot in a little bit closer. If I wanted to bias it towards the right, I would have my right foot in a little bit closer and the left one out a little bit further. Remember, outward pressure on the belt or the band throughout the whole movement. Okay, that's hip bridging. If you're doing it properly, you should feel a little bit of effort in the sort of hip and leg area. If you're getting low back pain from doing hip bridging, it probably means you're pushing up too high. So just back it off a little bit. You don't need to push up so high. Hope this video helps, and see you on the next one.